Hello, I'm Dr. Williams. I'm here with Mom Doc, and today we're going to talk about syphilis. Syphilis is a sexually transmitted disease. It's actually caused by a bacteria. We call it the corkscrew bacteria because it looks like a little corkscrew. It's a little different than other STDs caused by a bacteria. If you look at gonorrhea, chlamydia, it's an infection, usually of the cervix, can easily be identified by a swab, treated with an antibiotic, and done. Syphilis is a little different. When you are infected with syphilis, it doesn't stay in one spot. It tends to travel throughout your body, making it a lot harder to identify. It's hard. Syphilis doesn't live, like, you can't get it through a blood transfusion, things like that, like you can HIV. HIV and other viruses can live for a long time in what I would call bodily fluids. Syphilis doesn't necessarily, but other forms of close contact, oral contact, genital contact, things like that. Syphilis can be transmitted that way. The one thing about use of condoms, which again can decrease the transmission, if you are exposed to that canker sore or you have an area in your skin or the mucosa that is open, the bacteria can still get in, even with use of a condom. So it is not 100%. Another reason syphilis is hard to detect because its initial presentation usually has what we call a chancre, which is literally an ulcer. When most people hear of an ulcer, they think of something that's painful and open. It is an ulcer, but the one thing about the ulcer of syphilis is painless. So if it's outside on the vaginal area, out externally, you can usually see it. But if it's inside the vagina or in the mouth, it can go totally undetected. Then there is what we call secondary syphilis, which usually again happens within the first few months of exposure or of being infected with syphilis, that it can come back. And this is usually when most people will seek medical attention. It shows up in the form of a rash that can be all over your body, from your trunk to your arms, and one place it likes to show up is on the palms of your hands and the soles of your feet. It's usually associated with swollen lymph nodes, flu-like symptoms where you can get fever and headache and just body aches. So we tend to have a more, like I said, full body response to the syphilis infection. And then what happens, syphilis goes into what we call latent phase syphilis. The bacteria is still multiplying in your system, but it's doing it in a silent way. This can go on for years, and it's been reported even as long as 30 years before syphilis can show up again, and then it shows up as what we call tertiary syphilis. And that's where it can be really severe because it can attack, there's what's called neurosyphilis. It attacks the brain, can cause strokes and other issues there. It attacks the eyes and can cause blindness, which is called ocular syphilis. It can attack your kidneys, your heart. A lot of times when you get to the tertiary phase, the damage done is not reversible. Probably the biggest inhumane events came about with the study of syphilis. The issue with the Tuskegee syphilis experiment. This is an experiment that went on from, it started in the 1930s and went all the way to the 1970s, where they enrolled hundreds, and all of them were African American males, probably on the order of 600 to 700 men with known syphilis, that they studied year after year after year for 40 years or more. Even when it was identified penicillin is a simple treatment for syphilis back in probably in the mid 1940s, they refused these men treatment or didn't let these men know there was a treatment protocol that would easily cure the syphilis. They continued to study these men with known syphilis to see what happened. So the reason we know about primary, secondary, latent, and now tertiary syphilis because they allowed these men to stay actively infected with syphilis and did not offer them treatment. And that's where most of the information of syphilis has come from. When it is finally diagnosed, the good thing is there is treatment for syphilis, and it can be cured. Just not treated, it can be cured. The treatment is also based off of the stage of syphilis. So if you are diagnosed in what we call early stage syphilis, meaning the primary or secondary syphilis, when you have just the canker sore or if you just have the rash, the treatment for syphilis is a one-time injection of penicillin. Late syphilis means if it's diagnosed in the latent phase or if you have signs of tertiary symptoms, the initial treatment is 3 shots of penicillin, given 1 shot a week for 3 weeks. For those patients who have signs of neurosyphilis, ocular syphilis, or where it attacks the heart muscle, then of course the treatment may have to be altered to meet their symptoms. Some would have to go on a continuous IV infusion that can last for up to 2 weeks, but still, usually you can treat the actual infection with antibiotics. I'm Dr. Williams. We here at Mom Doc are stamping out syphilis every day, so come on in if you think you got it. That's so awful if you put that in there.